Hi, I'm Sydney Bacon. I'll be doing tracheostomy care today. The indications of tracheostomy care is when the patient's tracheostomy area has filth or dirt around it and it needs to be cleaned. And the complications of tracheostomy care is bleeding, possibly hematoma, and infection of the stoma or the lungs. The frequency of tracheostomy care should be at least every shift or PRN, which is as needed. You will first start off by checking and verifying the doctor's orders and checking to make sure the patient is the right patient by checking the patient's wristband. And then you would introduce yourself. Hi, I'm Sydney Bacon. I'm respiratory and I will be doing tracheostomy care on you today. And you would explain the procedure and follow on. First, I'll be putting my gloves on, my non-sterile gloves. And some patients, actually most patients, most likely will need suctioning before tracheostomy care. So when you do suction, you would do a septic technique with suctioning. I now have my gloves on. We're going to start off by removing this nasty, dirty gauze and discarding of that. Then we will take out our equipment as needed and lay this tissue across the patient's chest. Take out our gloves. And we will proceed and in this tray we have 3 compartments and we will have hydrogen peroxide and sterile water in there. Proceed to putting on my sterile gloves. That's one glove. And that's the next glove. Now I have my sterile gloves on. And then we would take one of the Q-tips and hydrogen peroxide and wipe around the stoma area in one specific direction and discard of that. And then follow it up with sterile water and discard of that. And you could do this about 2 times. Then you would take your gauze and give it one big great wipe to get the gunk out. And then you would discard of that. So now we have the patient's stoma area cleaned. So we proceed to take out the inner cannula and we will place that in hydrogen peroxide to let it soak, and hydrogen peroxide should bubble because hydrogen peroxide interacts with bacteria and it bubbles. And if the patient is on the vent, then you will put a disposable inner cannula in so that the patient can still be connected to the vent. So as we let that soak, you be sure not to touch the distal end, which is the sterile end. And then you will clean the inner cannula with the brush and get it real clean, rub it up. And you clean the inside of the inner cannula with the pipe cleaners. Rub it, make sure not to let your gloves touch it. Then you will rinse it in sterile water And with your second pipe cleaner, you can be sure to dry out the inner cannula to make sure that it is dry. And you replace the inner cannula back into the patient's hole, stabilize it, and lock it. So now we have cleaned the inner cannula, cleaned the stomy area, and now we need to remove the cloth ties. So when doing this, you will first remove the dirty cloth ties. And remember to stabilize the cloth ties, the tracheostomy area by holding it. Discard of this, and you will now replace it with a new one. When doing this, you want to make sure that you have at least 2 fingers length to put under the patient's neck, just as when securing an intratracheal tube. You put the tube under it. You would start off and then you would tie it and make a loose slip knot. You do the other side just as well. And now we have replaced the tie, so now we need to replace our gauze with a clean gauze. So usually you would have tweezers to put the gauze under. And with as much care as possible, you replace the gauze and put it back under the patient's neck. And you want to make the gauze as flat as possible, so that none of the wrinkles will cause pressure on the skin and cause sores to evolve into the skin. And you would discard of all the dirty materials. So now as you're done with the procedure, you will follow up with the patient and check for breath sounds, respiratory rate, heart rate, and make sure that the patient is breathing at an appropriate level. And then you would wash your hands and order a X-ray to make sure that the tracheostomy tube is placed in the right place. And you would make sure that the patient has adequate humidification. And then you would be done with the procedure.
Identify 2 different systems that allow trach patients to speak.
The elliptic trach valve and a passive Muir valve.
Describe the purpose of the obturator.
The purpose of the obturator is to make the passage of the tracheostomy tube through the trachea less traumatic. And that is it for tracheostomy care today.